Welcome everyone to My Weight World TV. I'm Dr. Brenda, MD. Today I have Dr. Michael Epstein in the studio with me. He is a board-certified plastic surgeon in the Chicagoland area. He is a fellow of the American College of Surgeons and is certified by the American Board of Plastic Surgery. He has been in private practice since 1992 and provides a comprehensive range of cosmetic plastic surgery and non-invasive treatments to his patients. Welcome, Dr. Epstein.
Hi, Brenda.
Can you tell me a little bit more about yourself?
Sure. Let's see, where can we start? I'm originally from Detroit and grew up there, so for all you Chicagoland people, don't hold that against me. I went to the University of Michigan for undergrad, went to Wayne State Medical School in Detroit, did most of my surgical training in Chicago, and that's how I fell in love with the city. And then came here to start my practice in plastic surgery.
How did you get involved with plastic surgery?
That started in medical school when I was introduced to one of the forefathers, modern-day forefathers of plastic surgery, Dr. Marty Robson. He was at that time, the chairman of the Department of Plastic Surgery at Wayne State University. And he kind of mentored me, turned me on to plastic surgery and all of what it's about and what it could become. And from there, I fell in love with it and pursued that career. I always knew that I wanted to be a surgeon. I know we're both physicians, and I think one of the first decisions you make when you're in medical school is, are you going to lean toward medicine, or are you going to lean toward surgery? And I sort of fell in that surgical arena, and then from there, I loved the idea of taking somebody and changing their lives for the better. And that's what I think plastic surgery is all about, both from the reconstructive and from the aesthetic or cosmetic end.
Yeah. So on that note, what is your philosophy when dealing with the bariatric patients in particular?
Well, my philosophy isn't all that different from how I look at any patient that comes in my office. And first they have to have an identifiable problem, something that really troubles them or bothers them, and it's something that I have to be able to fix with a surgical treatment. And once we've decided that, they also have to be healthy enough to withstand a certain surgical procedure. And of course, they have to be of sound mind, meaning that they mostly have to have pretty good expectations of what the results are going to be, what they're getting themselves into, because it is surgery, and what the recovery process is like. And once we've sort of determined that at the initial consultation, and I've met them probably at least one other time before they have their surgical operation, we proceed. Now, I will tell you probably one of the main differences between an overweight or bariatric patient and the rest of my patients is that at the initial consultation, we have a heart-to-heart about, have they done all that they can do to lose weight? If they came in to me, and they are still considerably overweight. Most of the time, when I see the patients coming in my office, it's after they've lost a considerable amount or all the weight that they can. And that could be through diet and exercise, or it could have been because they've had a bariatric surgical procedure, like a gastric bypass or an intestinal bypass, or one of those procedures to help them lose weight.
What are some typical procedures that you perform on bariatric patients?
Well, Brenda, there are actually a whole slew of procedures that can be done on these types of patients. And it really depends on what the particular problem is what is the foremost problem in their mind. I would say most of the time when these patients come into my office, they're concerned about all of the extra skin and extra subcutaneous tissue that they can't burn off around their midsection. And so we typically start there. And that usually puts them in the realm of abdominoplasty, otherwise known as a tummy tuck. And there are a whole slew of different types of tummy tucks that can be done, of course. But most of the time, these patients are doing some of what we have to get into is an extended version of an abdominoplasty or a circumferential body lift, where I'm literally removing excess skin and fat circumferentially around their entire torso. Okay? And that skin can come off anywhere between the mons pubis area, the right at the pubic bone, all the way up just above the belly button or the umbilicus, and circumferentially all the way around. A lot of times I'm combining that with a little bit of liposuction to tailor and contour the operation. And once that's done...
Well, you determine which procedure depending on how much tissue or needs to be removed?
Correct.
Okay.
Correct. Most of these patients aren't coming in for what we call as a mini abdominoplasty, where we're just excising a little bit of skin, below the umbilicus just to tighten up some skin.
Okay.
They have more than that, much more than that, because here again, as we've talked about before, they've lost this weight.
Right.
They're a deflated balloon, and we need to get that off. And the skin is a problem for them because it's not only an emotional problem, but it's a physical problem because it creates a lot of irritation. They can have skin problems underneath these folds, exactly, and infections. Right. You may have seen it yourself in your practice. And then sometimes, depending on the magnitude of that operation and the health of the patient, we can combine this with other operations. We can combine it with oftentimes they need a breast lift if it's a female patient. Frankly, even if it's a male patient and they have a lot of sagging of the skin in the chest area, we do a breast lift. Sometimes that can be extended again into a full, what we call a torsoplasty or an upper torsoplasty, where we're excising skin circumferentially all the way around the chest and keep the incision line right in the bra strap line so that if they are wearing a bikini top or a bra, you can't see the scar. Then that can lead us into things like arm lifts and thigh lifts, where you're excising extra skin and some fatty tissue from their thighs. When you're talking about medial thigh lifts, the incisions are hidden right in the groin area. And for a brachioplasty, that's the medical term for an arm lift. We're excising all that extra skin from the arm above the elbow. I do my own procedure where I've sort of created an operation where I combine that oftentimes with the torsoplasty and breast lift. So it's almost like a continuous incision from the breast into the outside of the chest. Actually excises a lot of that skin that's into the armpit or the axilla and into the upper arm. And it's a wonderful operation.
Right. All one general anesthesia.
Yes. That's another thing I'm glad you brought up. In my facility, where I do 99% of these operations, I have some excellent board-certified anesthesiologists that are trained specifically for this type of work. And they're also on staff at the hospitals that I'm on staff at, which is Evanston, Glenbrook, and Highland Park Hospital. And I've handpicked a couple of them to come into my office, and we give an anesthetic that's very different than what you see in most hospitals, where they're asleep, but they're breathing on their own the entire time, which is phenomenal for the patient.
Decrease risks? Right?
Decreases risk, decreases the risk of nausea afterwards. They wake up much cleaner and without that sort of cobweb feeling and the feeling of potentially getting sick to their stomach. So it really makes it easier to become an outpatient procedure, okay, which many of these are.
Right. How have you, in your experience, have these procedures changed the lives of your patients?
Well, that again is a great question, and this is probably one of the things that I love most about my practice, is the reactions and the feelings of the patients when they come back into my office and they're 2 or 3 months post-op, and they are just, they're showing off their body, they've got an extra hop in their step, and they feel fantastic. I mean, they've got a lot of this weight and then this extra skin off. Most of these patients go on to lose even more weight, and they, frankly, if we've done 1 or 2 procedures and we had talked about the need for some of these other things that I just talked about, they can't wait to schedule for another operation because they feel so good about themselves.
Well, once you start feeling good, it feeds on itself when you start.
Right.
Yeah. What other services do you offer in your clinic?
Well, in addition to all of the traditional surgical procedures that a plastic surgeon offers, I do facelifts and rhinoplasties and things like that in my office. In fact, the most common procedure that I do is breast augmentation. Many of these types of patients that I'm seeing don't need that. I'm probably, again, one of the more common operations that I'm doing is nose reshaping or rhinoplasty surgery. And then we have a whole section of patients that are getting rejuvenation for the face. People that are coming in for facial aging. And that leads us into the non-surgical therapies and treatments that we offer in my office. In addition to the surgery that I perform, I have an entire medical spa. We call it Transcend Medical Spa in my office. And I have registered nurses that are doing injectable treatments. We have a procedure that we call a liquid facelift, where they're doing combinations of Botox injections and filler to stave off or slow down the aging process, and then they don't necessarily need a surgical facelift yet. We're doing skin resurfacing now. We're fortunate that we have just acquired the latest technology in fractionated CO2 laser resurfacing, which is phenomenal. It's called dot therapy, or it's the dot therapy laser, and what it does is it's similar to the principle of CO2 resurfacing, where you're actually ablating or taking off the top layer of the skin, but we're doing it in a fractionated way, so the healing process is so much faster, and it can be done serially, where the patients can come in and there's really no downtime. They may be red for about a week, and then they're looking great, and they may come in 6 weeks to 2 months later for another treatment. After they've had 2 or 3 of these treatments, their skin looks phenomenal. Wow. And then we complement that with skincare. We teach them about how to take care of their skin with good, excellent products. Right. We take pride in doing some other things like non-surgical treatments to reduce fat, so that some of the patients that come in with small amounts of isolated fat pockets, we do what's called liposonic therapy, which is another treatment that has sort of been, I sort of put together 2 treatments to create our own, where we combined external ultrasound and injection lipolysis, where we're injecting a medication under the skin to actually dissolve fat away. And for the patients that want to avoid surgery, they can come in, have a few injections and a nice ultrasound treatment, and over a series of treatments, maybe 3-4 treatments, they can actually melt away that fat that they didn't want. Maybe a little pocket.
Any downtime with that? Or?
There's absolutely no downtime.
Wow.
They will have a little bit of swelling and some itching for a few days, but they can get back to the gym that day after having that treatment.
Well, thank you.
You're welcome.
Well, thanks
it was
for
a
joining
pleasure.
us.
Yeah, it was great.
Okay. And please tune in again next time to My Weight World TV, so we can help you reach your goal with our community. I'm Dr. Brenda, MD, and thanks for watching.